So my name is Lisi. I'm an occupational therapist working at Phyllis Tuckwell Hospice Care, and I have an interest in promoting social and therapeutic horticulture for palliative care. Many of the people who are affected by life-limiting illness have perhaps been out into nature, might love the seaside, or have done gardening, horticulture in their lives. But because of illness and the way their diagnosis has affected them, they've not been able to continue to use it. Every hospice has a garden. I think that's right in saying so. Are we really utilising this wonderful resource to the full? We know about hospice's design, the natural light, trying to get nature to be part of the indoor healing environment, but actually to be using our outdoor healing environment more. Well, there's a multiplicity of ways that social and therapeutic horticulture can actually be used. It can be through, for example, sessions which I've been running, which is based on indoor tabletop gardening. And the reason that we do this is that it's totally inclusive. So somebody might be an inpatient on the ward or attending the day hospice, or they might be an outpatient, might be a carer. Everybody really is able to participate. So that might need, for example, I might need to adapt the activity so that the person can actually participate. For example, if someone's on oxygen 24/7, or if someone hasn't got functional use of their hands, we are able to adapt the activity so that they actually complete, for example, a garden planter just as efficiently as somebody who has got full hand function and full range of movement.
I've attended 4 tabletop gardening sessions here at the day hospice, and after the first one I ended up crying because I was so happy to have done gardening for that length of time, because I hadn't been able to do any for so long. The first thing we did was a herb planter, which I gave to my mum. So the things that we've done often have a second life of me being able to give them to people to say thank you for the things that they've done for me. But now I'm appreciating just sitting and looking and actually doing what I used to have to do as a child, just smelling the roses. So I'm going to cry, but it's going to cry through happiness.
It's a beautiful piece of research from Dr. Anna Adevi, which I've been reading recently, and it shows that if somebody is sitting out, for example, in a garden after they've had a therapy such as physiotherapy, their physiotherapy is enhanced. The benefits of being able to grow fruit and vegetables for health. There's lots and lots of different aspects to this. The cost of running social and therapeutic horticulture can vary from running it on a shoestring, for example, encouraging the use of the gardens, sitting out in the gardens, thinking, for example, about patients if they're awake in the morning early, will the nurse open the window so that they can hear the dawn chorus? There's little facets which are changing the culture. To running, for example, indoor tabletop gardening sessions. My advice to other hospices would be you would be very welcome to email me if you are interested in developing social and therapeutic horticulture for palliative care in the hospice setting.